Good afternoon, everyone. My name is Molly Howell, and I am the Immunization Director for the North Dakota Department of Health. And I would like to welcome you to today's town hall on back-to-school immunizations and COVID-19 vaccines for children and teens. August is National Immunization Awareness Month, and so we just want to promote all the positive benefits of vaccination and make sure everyone is aware with school starting in the very near future that now is the time to get your child up to date if he or she is not yet up to date. And we have two excellent presenters here with us this morning, or this afternoon. Both are pediatricians. So our first presenter is going to be Dr. Tr-acie Newman, and she's a board-certified pediatrician at Sanford Health in Fargo and is the City Health Officer for Fargo Cass Public Health. She's a graduate of the University of Minnesota School of Public Health and the University of North Dakota School of Medicine, where she currently serves as an associate professor of medicine. She completed her residency in pediatrics at the University of Minnesota. Dr. Newman is also a member of the Fargo School Board and has expertise in and a passion for preventative health, vaccines, and public policy for children. She has a strong interest in public health and vaccines and travels throughout the state giving talks to other clinics regarding vaccine safety and efficacy. Dr. Newman is married and has three, I'm sure, fully vaccinated children of her own. And then our second presenter today is going to be Dr. Bakke. She's also a board-certified pediatrician who's been with Sanford Health in Fargo since 2010. She's a graduate of Concordia College and the University of North Dakota School of Medicine and completed her residency in pediatrics at Nationwide Children's Hospital. Dr. Bakke is married and has 4 children and enjoys running, traveling, reading, time at the lake, and spending time with her family. Neither of our presenters today accept any funding from pharmaceutical companies, vaccine manufacturers, and so I just wanted to point that out for everyone. And I will turn it over to Dr. Newman to kick us off.
Thank you, Molly. Make sure everyone can see my screen here. Okay, thank you so much for the introduction. Dr. Bakke and myself are very excited to talk with you today about these topics. So just kind of a preview of what's to come. I'll start by reviewing what I like to call forgotten diseases, thanks to vaccines. And then we'll touch on the one we wish we all could forget, COVID-19, and the importance of vaccination coming out for children for that. And then Dr. Bakke will walk us through how we're doing in North Dakota, looking at our current childhood and adolescent immunization rates and trends. And then we'll end on just some general vaccine considerations and take some questions from you guys. So just to start, back to school time is a time of organization and preparation, making sure we have back to school supplies, we have everything we need for our kids. And we really hope that within that is included ensuring that your children are up to date on all of their well child care, as well as their recommended immunizations for their age. We know that vaccines protect students from diseases and keep them healthy all year long. And this is especially important during a pandemic. One of the unfortunate fallouts we saw last year around this time was people foregoing coming in to see the pediatrician, coming in to have well child care, and even foregoing regular childhood immunizations. So the last thing we want to see during a pandemic is a measles outbreak or another vaccine preventable illness outbreak. So important we stay up to date on that. And really just vaccines are arguably one of the greatest public health successes of all times. I think, maybe secondary to clean water and sanitation, they're probably the greatest global health achievement of all time. They really have shaped and changed the way we live. They've changed how long we live and how healthily we live. So really the parents of today, of this generation, don't need to worry about a lot of the vaccine preventable illnesses of previous generation of parents. It's probably something most of us don't even think about. But it's important to remind ourselves that every disease that we vaccinate for still circulates in our world today, and it can just be an airplane ride away, unfortunately. So this section I like to call diseases we forgot about thanks to vaccines. So we'll just kind of briefly run through these. We'll start with polio. Again, probably something you've never seen or thought about. I certainly know my parents' generation did see polio and knew people with polio. But it is an infectious disease caused by the polio virus, and it infects your brain and spinal cord and can cause paralysis and or death. It is an infectious virus that spreads person to person, and thankfully vaccination has eliminated polio in the United States, but it does still remain a threat in other countries. And so the best way to prevent this, of course, is ensuring that our children and infants are vaccinated. Next, we have tetanus. Parents used to warn kids about getting tetanus if they were scraped or cut by metal. Again, it's probably something we don't even really think about today, but it is a serious, potentially fatal infection caused by a toxin made by a certain bacteria. It causes very painful muscle stiffness and lockjaw. What's interesting about tetanus is it actually is not contagious and it does not spread person to person, but it's found in our soil. And so it gets into the body by contaminating wounds. But now tetanus is very rare in the United States because of immunizations. Measles. Measles is a highly contagious, very serious illness, especially for young children. A child can contract measles by being in the same room with an infected person, even after that, up to 2 hours after that person has left the room. Unfortunately, it remains common in other parts of the world. So unvaccinated travelers can contract measles and bring it back to the United States. And this is one we certainly have seen outbreaks in our country in recent years. Right out of my residency, I practiced in Minneapolis, and we actually did have a small measles outbreak when I was in practice there in our Somali population. And I did actually diagnose and care for a few children with measles, something I never thought I would do in my career. And I can tell you that these children were miserable, and we really don't have a cure. It's just sort of supportive cares for them, and it's certainly not something we want to return to. Mumps. So mumps is a contagious disease, also with no treatment. It's best known for causing that puffy cheek appearance or the swollen jaw, and that's due to swelling of the salivary glands. It can also cause much more serious things like inflammation of the testicles or arthritis, deafness, encephalitis, which is inflammation of the brain, meningitis, inflammation of the protective membrane around the brain or spinal cord. And it is still a threat today. Actually, every year in the United States, people get the mumps, and those outbreaks usually involve some sort of close extended contact with infected people. Rubella is also known as German measles. It is spread by coughing and sneezing. It's especially dangerous for pregnant women and developing babies. It can cause miscarriage or death right after birth, but it also can be an infection that's passed to the developing fetus and cause many birth defects after a baby is born. Diphtheria. Diphtheria is a bacterial infection that is spread easily through respiratory droplets or through sneezing and coughing. It causes this sort of thick covering in the back of the mouth, back of the throat, making it very difficult to breathe or swallow. It can also lead to things like heart failure, paralysis, and even death. But thanks to vaccines, most of us probably only know diphtheria is some obscure disease from the past, but it is, again, it does still exist in the world today. Chickenpox. This may be one that people are a little more familiar with. This is an infectious disease that causes fever, itchy, blistery rash. Infected people can have as many as 500 blisters covering the body. But it's important to remind ourselves it can also be life-threatening, especially in young infants under the age of 12 months, in certain older adults, or in people who have weakened immune systems. And even very healthy children can become very ill. My personal story I can share about this is my own daughter contracted chickenpox at the age of 9 months, which is too early to be vaccinated. We give the first vaccine at 12 months. Again, we were living in the Twin Cities, and she was exposed in a ECFE class to an unvaccinated older child. And it was miserable as a mother. She was covered in lesions. She had lesions inside of her mouth, making it very difficult for her to breathe or to feed. We almost had to bring her into the hospital. for hydration, but not something you want to go back to, definitely as a mother or a provider. Pertussis or whooping cough is a highly contagious disease which can be deadly for babies. It causes uncontrollable violent coughing jigs, which often make it very difficult for people to breathe. The whooping name comes from this sharp intake of breath that occurs right after severe coughing, and once you hear it, it's very distinct. But in babies, it can be life-threatening because it causes apnea or pauses in their breathing, even with no cough. So mothers, this is one that we really urge pregnant women to get vaccinated for during every pregnancy in order to pass protection from to the babies before birth. And unfortunately, this is another one that we've had outbreaks in our country in recent years due to waning immunization rates. Since 2010, we've had anywhere from 15,000 to 50,000 cases reported each year in the US. And to date, we've had cases reported in every single of our states. Influenza is, of course, a respiratory illness that infects the nose, throat, and lungs. It can affect people very differently based on their underlying health status, their immune system, or their age. It is dangerous for all children, but it's especially dangerous for babies under the age of 6 months. We know they're more likely to require hospitalization for their care. Symptoms in young children can include coughing, fever, body aches, fatigue, and vomiting and diarrhea. Every year in the United States, otherwise healthy children are hospitalized or die from complications from influenza. And again, we encourage pregnant women to get a flu vaccine during every pregnancy, and all caregivers around close contacts of infants should be vaccinated. In pediatrics, we talk about the cocooning effect that young babies aren't able to get their first flu vaccine until the age of 6 months. So we really encourage everyone around them to create a cocoon of safety and immunity for them. And then, of course, everyone over the age of 6 months needs a flu vaccine annually. Meningococcal disease causes meningitis, which again is an infection of the lining of the brain and spinal cord, and infections of, or it can cause sepsis, infections of the blood. And even when treated, meningococcal disease kills 10 to 15 people out of 100. And of those who survive, 10 to 20 out of 100 will suffer disabilities, such as hearing loss, brain damage, kidney damage, loss of limbs, or ongoing problems with the nervous system. So my little blue graphic here in the corner said a different way. 1 in 10 people who are infected with meningococcal disease will die, and then 1 in 5 people with meningococcal will have long-term sequelae or disability of that. And especially high-risk group for this, again, is infants under the age of 1, adolescents and young adults, which is why we now vaccinate teenagers for this with a booster, and immunosuppressed people. Human papillomavirus, or HPV, is a virus that causes disfiguring lesions and certain types of cancer. It is spread through intimate skin-to-skin contact or sexual contact. HPV infections are very common in our population. Nearly all men and women will get at least one type of HPV at some point in their lives. It's estimated that 50% of college, by the time a child graduates college, up to 50% of them will have been exposed or carry at least one strain of HPV as well. But the good news is our vaccines prevent greater than 90% of the cancers that are caused by HPV. And then I just wanted, these are not necessarily back to school vaccines, but listed here are other diseases that we now prevent in the early childhood years or infant years for children. Okay, so now the one we wish we could all forget, of course, COVID-19, caused by a novel coronavirus or SARS-CoV-2. In children especially, it's just a wide array of symptoms. Some kids can be completely asymptomatic and show no signs, not even know they have it. And then all the way to the other end of having, respiratory failure and unfortunately even death. From a grand eye view, in the US of total deaths, we've had 615,000 in our population, and at least 400 of those have been pediatric deaths. There's also rare complications that can occur in children, something called MIS-C, which is multi-inflammatory syndrome of children. This is sort of a rare but serious thing that causes inflammation in children's body of like the brain, the kidneys, the GI tract, and other things. It almost always requires hospitalization and sometimes ICU care. And we're really, it's unknown why this happens in some children and not others, but we do know that every case of MIS-C started with either a child having COVID or having been directly exposed to the virus. And so U.S. viral spread is now predominantly among our unvaccinated people. And unfortunately, the largest population within the unvaccinated that's growing are children under 12, as they are not yet eligible for vaccination. We know that since the start of the pandemic, we've had 4.2 million total pediatric cases of COVID-19. And in recent weeks, we've really seen children start to make up a higher proportion of our overall infections. This trend is expected to continue. So as of last week, the week ending in July 29th, nationwide, we had nearly 72,000 new pediatric cases. This is a substantial increase to what we're used to. Even just the week prior, there had only been 39,000 cases. So we saw an 85.6% increase in 1 week. And a lot of this is thought to be due to the new Delta variant, which we'll touch on as well. Just to talk, that was nation's data. So just to talk about our North Dakota stats, as of the end of July, we've had 16% of children from the ages of 12 to 17 have tested positive for COVID-19. As of July 19th, we've had 24 hospitalizations. Again, this is just in that older age range of 12 to 17 who can be vaccinated. State hospitalization rate for this age group is 3.25 per 1,000. And we have had 8 cases of that MIS-C reported in North Dakota to date. In the United States, there's been over 4,000. And we've had 1 death in North Dakota in this age range. So just a brief note about this new Delta variant that is really changing the landscape, I think changing the game here a little bit. We know that this new variant is highly more transmissible, 200% more transmissible than our previous strains, and it results in 1,000 times higher viral load, meaning that people carry this in a much higher rate in their noses and can transmit it much more easily. In epidemiology, we talk about something called R0, and the R0 of the Delta variant is 6 to 10. So this would mean on average, 1 person could infect 6 to 10 other people. To put that into perspective, the previous strains like alpha strain had somewhere of an R0 of 2 to 3. And this type of R0 of 6 is similar to that of chickenpox, and it's actually higher than what we saw with smallpox, so highly contagious. And we now know that although rare, vaccinated people who become infected can actually spread Delta to others, which is what's prompted the CDC and other medical groups to update their recent guidelines on mitigation strategies for this. And Delta now accounts for 93% of the US cases that are being sequenced. And it's been predicted by public health experts that we could see, 100,000 to 200,000 new cases per day in our country of this fall. And in fact, August 3rd, we did see greater than 100,000 new cases. That's the highest we've seen in 1 day in over 6 months. And unfortunately, our new 7-day average was now 94,800. So, considerations for children and adolescents, we know now that this is not the same dialogue that was said earlier in the pandemic, that maybe they aren't as high a risk or maybe they aren't spreading this. I think that this is really changing. So we do know that they're at high risk for serious illness and unfortunately long-term health issues. In fact, COVID-19 is now classified in the top 10 causes of death for United States adolescents. We know they can be the source and recipients of outbreaks, that we certainly saw that with sports teams and in unmasked classrooms in schools this past year. And children are at high risk from the variants, as we've just discussed. Briefly, I'll just touch on another sequelae that's emerging. We really need more research on this, both in adults and children, but something we're seeing and learning more and more about is this long COVID that occurs in kids. It's similar to what you might be familiar with that occurs in adults. It's currently, we think, represents about 5 to 10% of cases, but in adolescents and older children are much more likely to experience this versus younger children. But it's things like just, having symptoms at least 4 weeks, maybe even a few months after your COVID infection. Most kids reported experiencing fatigue, headaches, brain fog or difficulty concentrating, and then that loss of taste or smell. Interestingly, in some studies in kids, kids can experience this long COVID even if they were asymptomatic with their initial infection. Okay, so our hope out of this, COVID-19 vaccines. We currently in the United States have 3 vaccines that have received emergency use authorization for adults. The only one available to children over 12 is the Pfizer vaccine. And we do have clinical trials underway for children as young as 6 months to 11 years old. And all the research we have to date from these trials show that the vaccines are very effective and safe. The American Academy of Pediatrics and other major medical groups urge children and adults to get vaccinated as soon as the vaccine is available to them. As of July, so end of July, the CDC reported 9.6 million US children under the age of 18 have received at least 1 dose of the COVID vaccine. If we break that down, 49% of 16 to 17-year-olds and 38% of 12 to 15-year-olds. When we look at our rates in North Dakota, as around the same time, end of July, 12 to 18-year-olds with 1 dose, 24%, and 12 to 18-year-olds that are fully up to date or both doses, 19%. So again, it's really important for students to be up to date on all their immunizations as we head back to school. And COVID-19 vaccines can be safely administered with other vaccines that we give. So the Pfizer and Moderna vaccines require 2 doses, and the Johnson & Johnson is a single shot. The 2-dose series, which is the one available to children, is what we call messenger ribonucleic acid or mRNA vaccines. I just want to touch on this briefly because we get a lot of questions about it. And this is the vaccine, again, that's currently available to children. It does not contain live virus or any live or dead parts of the coronavirus. It's made up of something called nucleic acids, which are the building blocks of cells. And once the mRNA has done its job in our bodies, it falls apart and exits. So there's nothing left behind. So a little more detail about that. I like to kind of say that the mRNA vaccines give our immune system instructions on how to recognize and fight COVID-19. So the mRNA vaccines, every coronavirus is covered on the outside by these things called spike proteins, which you can see there. And the mRNA vaccines give instructions to our cells of how to make a spike protein or a small harmless piece of the COVID-19 virus. So once the vaccine is injected into your muscle, it will enter the cells in your body and begin instructing them how to make that spike protein. The spike protein does not cause people to become ill with COVID-19. So after your muscle cells start to make this protein, your immune system will recognize it as foreign or not belonging there, and it will trigger your immune system to start making antibodies that will specifically recognize that spike protein. What that means is if you're ever actually faced with the virus in nature or you're exposed to COVID-19, your immune system will be ready to go and ready to fight that. So some of the hesitancy we hear from parents, this is a new vaccine technology. I just want to wait a little bit before vaccinating my child. And while that's a legitimate concern, I try to remind people that the mRNA vaccines are new, but they aren't unknown. So this vaccine technology has actually been around for many years. It's been studied for decades. However, the widespread use of mRNA vaccines is new. But again, they do not affect or interact with your DNA in any way. That's another concern we hear, that this is gene therapy or affecting your DNA. The mRNA in the vaccine, it never enters your cell nucleus, which is where the DNA is kept. And again, your cells break down this and get rid of the mRNA as soon as it's done with those instructions. Nothing remains in the body. Are COVID-19 vaccines safe for kids? And the answer is yes. Prior to the FDA authorization, clinical trials showed that these vaccines were remarkably safe and effective for adults and teenagers over the age of 16. These trials involved tens of thousands of volunteers, and after receiving additional safety data for younger adolescents, the FDA, of course, extended its emergency use authorization for 12 and up. And as we said, clinical trials are underway for very young children. Pfizer has actually said it hopes to seek emergency use authorization for ages 5 to 11-year-olds as early as the end of September. And of course, the vaccines continue to be closely monitored for safety. It was stated recently that these COVID-19 vaccines have undergone the most intense safety monitoring in US history, and I think that's accurate. So can COVID-19 vaccines cause infertility? Another question I get from parents, and the answer is no. There's no data to support this. Really, there's no evidence that any vaccine, including COVID-19 vaccine, causes fertility side effects. Vaccines don't affect a child's puberty or a child's reproductive development in any way. And in fact, COVID-19 is now safe and recommended for pregnant and breastfeeding women. So COVID-19 vaccines not only provide protection for your child, but also they reduce the likelihood that your child will transmit the virus to people in their inner circle, right? So such as grandparents, their friends, teammates, and classmates, and of course, teachers and coaches and other adults in their life. So with that, I will turn it over to Dr. Bakke to bring us up to date on how we're doing in North Dakota. Thank you.
All right. Thanks, Tracy. So to start out, we just want to go over what are the back to school immunization rates in our state. So this graph and these numbers are looking at kindergarten immunization rates about over the last decade. And I want to just point out a few important things I think on this slide. One is that our rates are really good. I think when parents are thinking about vaccinating their kids, sometimes they feel like, are most people doing this? You know, it seems like sometimes maybe you're talking and sometimes the minority can be really vocal, but the vast majority of parents in our state are vaccinating their kids, and the vast majority have vaccines completely up to date. So again, if you look at the trends over the last decade or so, it's kind of interesting for a couple different reasons. One is I think you can see that earlier in the last decade, the rates were lower. There's probably a few different reasons for that. One is probably with the oil boom, having a lot of students coming in from out of state. Sometimes they were up to date, but we just didn't have their records. I think any doctor can tell you how difficult it can be to get records from state to state, you know, if parents don't always have that on hand. School enforcement wasn't really great either, so they would forget to ask or even forget to ask for records. So that has improved over the last 5 years ago or so. And then you can see over the last year that we've had a dip again. And Dr. Newman kind of did reference that as well. We definitely had a lot fewer kids coming in for wheelchairs sort of early on in the pandemic and getting behind on vaccines. And, you know, that's kind of following us up to this day. I think it's getting a lot better, but it's still happening. And then if you look at the right side of the slide, you know, just our overall vaccination rates for those critical vaccines, like I said, they're good. Most people do vaccinate their kids. They're not quite where we would like them to be, though, especially for certain illnesses that are really contagious, such as measles, for example. Dr. Newman talked about how contagious that is. You don't even have to be in the same room as someone who's infected to get it. We really need the immunization rates to be somewhere around 95% to prevent severe outbreaks of things like that. So they're good, we're close, but we're not quite where we would like to be. So what are the kindergarten vaccines? Molly mentioned that our kids are up to date on their vaccines, and they are. This is my youngest son. His name is Isaac. He got his vaccines last summer when he was 4. You can give these, we call them kindergarten vaccines, or people do, but you can give them as early as age 4. The ones you need right before kindergarten: DTaP, IPV, which is polio, MMR, which is measles, mumps, and rubella, and varicella, which is chickenpox. Now, depending on your clinic, depending on what products they have available, it might not be 4 shots. In ours, it's only 2. So you can see he's got an orange Band-Aid and a yellow Band-Aid, and that's all he needed to be completely up to date at that stage and ready for kindergarten. We also recommend influenza vaccine, of course, if it's flu season. And then you know, kindergarten visit is a really good age to get any catch-up vaccine. So if you fall in behind for some other reason, it's a good time to get caught up on everything else. So then the next age that we look at when you have new vaccines that are recommended for school is 7th grade. And so again, you can see these rates. The graph of the rates over the last decade or so on the left and the rates on the right. And again, I just want to emphasize that most parents have their children up to date on vaccines. So our rates are overall really good. The vaccines and And then I'm just going to switch ahead to 11th grade immunization rates. So same thing. A lot of what's on this graph, polio, MMR, Hep B, varicella, 11th graders should have gotten those already. You don't need those before 11th grade unless you're behind. Same with Tdap. What you need in 11th grade, which is a relatively new requirement, I think in the last 3 or 4 years, they started requiring a new meningococcal vaccine. You get your first one at 11, and now they require a second one at 16 because they saw that immunity was waning in those kids. So you'll see that the vaccination rate for the meningococcal is not as high as for our other vaccines. I was surprised. I had to ask for clarification when I saw this graph because I cannot remember the last parent that I've had that's refused meningococcal disease or meningococcal vaccine, excuse me, for their kids, because I think everybody is sort of familiar with how scary meningitis can be and how deadly. But again, the rates are a little bit lower because it's a newer recommendation, and sometimes it just takes a little while for people to sort of come around to that. So this is Dr. Newman's kids getting their flu shots. And a few important things just to remember with immunization, it's a key preventive cornerstone in pediatric care, but it's not the only thing we want you to come in for. I mean, we think shots are important, but you know, there's a lot of other important things that support your health. So we talk about good nutrition, and good nutrition is imperative for good immune function. So is sleep. Exercise can also help with your immune function. We talk about screen time. We check for pubertal development. We check for scoliosis. We screen for mental illness. We do all sorts of things at these well checks that are important for both your immune health and your overall health. But again, there's really no replacement for vaccines. I mean, you can eat super healthy, you can sleep well, you can exercise, you can do everything else and have a pretty healthy immune system. But meningococcal disease doesn't care too much. It can really take you down. So all of those things are super important, and your doctor should be talking to you about all of those things. But we don't want to forget about vaccines. And, you know, adolescents, lots of parents are really good about bringing their babies in for shots and checkups when they're little, and then they often kind of fall off around this age. I mean, it's a good age if you've fallen off to sort of get back into clinic, because there's a lot of things at this age that we can pick up on as they're going through puberty and things like that, that make these checkups just really, really important. So again, I kind of referred to this a little bit, but what are the adolescent vaccines? So the first ones are at 11, and it's Tdap, which is a tetanus vaccine, diphtheria and pertussis, HPV, which prevents cancer. That's 2 doses, 6 months apart, and then your first meningococcal vaccine, you should get at 11. And then again, depending on the time of year and your exact age, seasonal influenza is always really important if you're over 6 months, and then COVID-19 vaccine if you're 12 and older, we're recommending that. And then when you're 16, you get your second meningococcal vaccine. There's a different vaccine that's called meningitis B, which is sort of a different strain of meningitis that has what's called a permissive recommendation. So that would be something to talk to your doctor about. It's a more rare form of meningitis. This is not a vaccine that's required for high school. Some colleges, most don't, but some colleges do require it. Again, that's another vaccine. I can't remember the last time that I've had a family decline that vaccine, because again, you know, meningitis is scary and deadly, and we want to protect our kids the best we can. And then, of course, seasonal influenza and COVID-19. So I just wanted to spend a few minutes at the end here just to talk about general vaccine considerations, just some general questions that parents have that we ask, and just to go over those to help people to feel more comfortable with what we're sort of doing in the clinic. So here's a big one. My child is healthy. Is this really necessary? I think we get this a lot. You know, we're homeschooling, he's breastfed, we only eat organic foods, you know, super healthy. And all of those things are wonderful. I mean, all those things are wonderful and super important. But yes, like, you should still have vaccines. I mean, even if you see no other humans, like Dr. Newman talks about, which is really impossible, but even if you see no other humans, your child can still get tetanus from playing in the dirt in the backyard. Okay, so these vaccines are really important for everything for 2 main reasons. One is because, of course, they protect your child. One of my favorite doctors that does a lot with vaccines always says the choice not to vaccinate is not a risk-free choice. People think a lot about the risks of vaccines and what if they have a rare side effect, but you also have to think about the risks from diseases. And when these vaccines go under approval and people are studying them, they really have to weigh the pros and cons. And there's no contest really with any of these, unless your child is a very unusual child that has some sort of medical condition or some problem that precludes them from getting a vaccine, the vaccine is always the better, safer choice. And like I said, healthy children and adults die from vaccine preventable diseases every day. But vaccines also prevent other people, in particular infants, the elderly, immunocompromised. Of course, we're seeing that a lot right now, during the pandemic, that those are, the elderly particularly and the immunocompromised persons are the main people that are being affected by COVID. I have a good friend actually who had multiple sclerosis, and she's on a drug that's basically a chemotherapy drug to keep her out of a wheelchair, and she ended up getting COVID and ending up in the ICU on a ventilator. She was 35, she has a young daughter. It was very, very scary. And fortunately, she recovered, but even after getting the vaccine, even after getting the disease, she still has no antibodies to COVID. So this is a person that is really dependent on the people around her to protect her, so that she doesn't get sick again and so that this doesn't happen again. Another good example is whooping cough, which I also have some personal experience with, because when I was pregnant, I unknowingly got whooping cough from working in the pediatric hospital, and I gave it to my daughter when she was 5 weeks old. She got extremely, extremely sick, puking, lost weight, would turn blue, would cough literally for hours every day. It was the worst experience of my life as a mother, because I was a pediatric resident at the time. I had taken care of babies who had died from whooping cough, and then I had given it to my own daughter, and it was horrendous. This was before it was recommended during pregnancy. Otherwise, I would have been up to date. But again, like the guilt of passing a preventable disease on to somebody that you love is something that you just really never get over. And I think it's really important. So what about the long-term effects? Again, a really good question. I mean, I think all of these questions are good and fair questions that are good to ask. Because, we care not only about if my kid's going to be healthy tomorrow, the day after, he or she gets his vaccines, but also, how is this going to affect him or her in like 10, 20, 30 years? All good questions. And I think we have to remember that vaccines are time tested. I mean, this really takes us all the way back to the 1100s when smallpox was like a very real threat. And people figured out that if they took some dried scab material from smallpox patients and inoculated kids and adults, sometimes it protected them. Sometimes it killed them, but sometimes it protected them. So that was kind of like the first, idea that people had. Okay, if we just take a little bit of this virus and give it to somebody else, this could be protective. Now, fortunately, we have a lot more hygienic ways that we can protect people from diseases now, and a lot more, specific and scientifically proven ways. But this goes back a long time. And then, the more modern smallpox vaccine was developed in 1798. We know that we don't even give that vaccine anymore because we were able to eliminate smallpox from the planet thanks to vaccines. Pertussis vaccine, 1915. You can kind of fast forward up to 2005 and 2006 is when the meningococcal vaccine and HPV vaccine were approved. And then, of course, we all know last year, COVID-19 vaccine. So with every vaccine that we have now, again, this is a question that we talk about a lot. There are no known vaccine side effects that occur more than 60 days after vaccination. They have a high bar for safety and monitoring, and they should. I mean, anytime you're injecting like a perfectly healthy newborn baby with anything, you better damn be sure that it's safe and that it's going to work. And they do. And we have a bunch of different monitoring systems that we do, not only studying the vaccines when they're in research, but there's lots of post-marketing surveillance that we do. There's VAERS, there's Vaccine Safety Data Link, all sorts of different systems that we use to pick up rare risks. And rare risks do exist. So I'm not going to stand here and tell you that there's absolutely zero risk to vaccinating your kid, because that's not true. So for like a couple examples, you can get thrombocytopenia, which is a low platelet count after MMR vaccine. I've never seen it, and I give MMR vaccine every day. I've never seen it, but it happens. But we do know that your risk of getting thrombocytopenia after measles virus is much higher than after measles vaccine. Guillain-Barré syndrome, which is like a neurological problem, can happen after influenza vaccine. But again, it can also happen after influenza virus, and it's a lot more likely to happen after you've been infected with the virus than after getting the vaccine. And then myocarditis is one that we're finding can happen after COVID-19. vaccine. Now, again, kind of looking at the pros and cons, does this make sense? This is a question, and it's a very good question that I've been getting a lot from parents, is about myocarditis, which is heart inflammation, which we are seeing, especially in younger men after COVID-19 vaccination. But the rate of that happening is about 1 in 20,000 people who get the vaccine, which is pretty low. Now, contrast that with some studies that they have done with patients who have had COVID, the disease. They did a study in Big Ten athletes, so young, super healthy, prime of their life athletes who had either asymptomatic or minimally symptomatic COVID-19 disease. And they found that about 2.5% of those college athletes had signs of myocarditis when they did MRIs. So again, there's still a risk, but really when you're comparing the disease to the risk of the vaccine, there's no contest. And then multiple studies have done that show that there's no relationship between vaccines and autism, SIDS, multiple sclerosis, or diabetes. So you can read about those, but you can be really comfortable that you're not going to put your child at increased risk for any of those chronic diseases by giving them their vaccines. So another good question. I mean, people will come in and I will say that I just know that parents always really want to do the best thing for their child. And so I think we kind of have to start with that. And I also want the best thing for my patients. So parents will come in and it's very stressful to be a parent. And especially when you're getting all this, different information and then you're the person that has to make that decision for your child or for your baby, it's a lot. So, how do you know who to trust? So there's, you could give a whole lecture on this, right? But there's just like a few things that I like to talk about when you're looking online and trying to learn about vaccines. One is to check the credibility of your online sources, like who is running this website? What are his or her credentials? So, is this a physician? Is this a different healthcare practitioner? Is this a politician? Is this a mechanic? Is this like, who is running this website? I don't think that necessarily just because it's a doctor that you need to listen to them, but I think maybe that, we should listen to physicians when you're talking about health issues more than you should listen to politicians. I mean, I would ask a politician how a bill becomes a law, but I probably wouldn't ask a politician like if I should vaccinate my baby or not. I think I would ask somebody else about that. Another one, is this person trying to sell me something? So this is something that I do for fun. I mean, you will find physicians online that are preaching against vaccines. It's a very, very small amount. I know a lot of doctors. I'm married to a doctor. When you go through medical school and residency, and just like working in the hospital and the clinic, you happen to know many physicians. I know 0 that don't vaccinate their children. I literally know 0 doctors that are not vaccinated themselves and their families against COVID-19, but they do exist. So I'm not going to deny that they exist. But when I find somebody like that, that's kind of trying to promote that online, I like to do a little bit of a deep dive of them and look and find, their website for their clinic or whatever. And I've never done that and not found somebody that's trying to sell something, that's trying to sell like a vitamin or a supplement or some sort of like, basically, that's not trying to sell something. And to me, that makes them lose their credibility a little bit. They're saying like, don't get these vaccines that really should be like free with your insurance or through Vaccines for Children, but take this pill that I'm going to sell you or try this medical device. So I think that takes away from people's credibility quite a bit. And then the other thing you can look at is, where is this information coming from? Do they have a source listed? Because a lot of rumors and misinformation are derived from half-truths, okay? So they might, take this little piece out of a study or that piece out of study and be promoting it as truth. So if you can really look at the primary source and read that study, and if you're not able to do that, if you haven't been trained to do that, you're really like the majority of people in this country. So it's okay to ask for help. It's okay to ask your doctor or somebody else that you trust that's maybe had more training in like reading scientific literature and statistics and things like that. And you should really talk to your healthcare provider. Like I think I already mentioned this, but I know that anytime a parent is concerned about something, they're just trying to do what's right. They're just trying to do what's right for their baby or their child or their adolescent. And I feel like that too. So I always feel like if we can start from that place, like, hey, we both want what's right, for your baby, we can have like at least a productive conversation. And this is one that always makes me sad. I've had this happen many times over the last weeks and months talking about COVID-19 vaccine. Is people will always start like, I'm not anti-vax. I'm not anti-vax. I just have some questions. You are not anti-vax for expressing concerns or asking for more information. Like, that is okay. That's what you should be doing. You know, when you're visiting your pediatrician or your physician, is asking questions about your health and about what we're recommending. And that's literally our job. So you should never feel like embarrassed to ask questions or hesitant. And if you're not able to have that relationship with your healthcare provider, you probably need to find somebody else. So what about this? Taking this like in a totally different direction, but this is, again, another really common concern that people have. Like, my kid just really, really, really hates shots. I have 4 kids. I have 1 kid like this. I've raised them all the same. I mean, some kids are just like that, okay? And so this is hard. This makes the visits really stressful. It makes them very stressful. Oh, I think I skipped a slide, actually. It makes them really stressful for the parents. It makes them really stressful for the kids. So the first thing that I always say is, like, you just have to manage your own anxiety. I mean, you've decided to vaccinate your kids. It's the right decision, you know, be confident. And you have to be empathetic but firm with your child. So, you know, this isn't like, do you want the blue cup or the green cup? It's like, you're going to get the shot today. You know, do you want it to be in this leg or that leg? You know, they can have some choices, but this is not the place to be wishy-washy or let them decide if they get the vaccine. I don't think it's good to let your 4 or 5-year-old make his or her own medical conditions. They're not really medical decisions. They're not really developmentally ready for that at that age. Okay, so you need to be firm. Please don't ever threaten shots as a punishment. We hate that. You know, it makes it seem like it's like an act of violence instead of like an act of love for what it really is. I mean, like, I know it's usually a joke, but sometimes kids really take that to heart, and that's really kind of hard to come back from. And then don't promise no shots unless you're absolutely certain. Again, I mean, this isn't something that people do on purpose, but it always just like makes for an uncomfortable appointment, or sometimes almost like forces you to come back if you've made a promise that you can't keep. So you can check beforehand, or usually I try to give parents a heads up, like, okay, at the next visit, you know, they're going to need 1 shot, or at the 9-month visit, if it's not flu season, he won't need any shots, to give you a heads up. But, you know, try not to make promises that you can't keep. And then what can you do at the appointment, you know, or right before the appointment to sort of make it easier? I mean, plan for a distraction. That's a big one. With little kids, like bubbles, books, things like that. With older kids, videos, or they can play, you know, it's like the only time I tell them, like, okay, you can take out your phone and play a game or whatever, watch something to distract yourself. Ask your doctor. Different clinics kind of have different resources. Some of them have like numbing creams and sprays that you can use if you have a child that's super anxious. We're lucky, we have child life personnel at our clinic, and we have this little thing called Buzzy, which is like this little vibrating object that they put with an ice pack that does help to take the pain away, and kids love it. Lots of kids ask for it every time. Sometimes teenagers very sheepishly still ask for Buzzy, and anyone can have Buzzy. It's not you're never too old for Buzzy. And then here's one that I do a lot. Every clinic sort of works different. And in our clinic, the workflow is usually that you get the vaccines at the end of the appointment, but I truly believe, and most of the nurses that work with me a lot know that, like, if you have a really anxious child, that's like the worst thing you can do, because the whole time their anxiety is just building and building and building. So if you know that you have a child like that, you can ask about getting the vaccine right away. Because I always tell my patients, you know what the worst part of getting a shot is? It's right now. It's right now when you're thinking about it and worrying about it. Getting a shot is a piece of cake, and then you're done and you don't have to think about it anymore. So, you know, instead of prolonging the experience of anxiety, just say, can we just get this over with? And then if you have a child who is very, very severely anxious, we have therapy for that. Actually, we have one child psychologist in particular that does a lot of what we call exposure therapy for kids that are really, you know, nervous about needles or different medical procedures. Typically, it starts like you just have to look at a picture of a needle, and then like look at a video, and then look at a syringe sitting on a table, and kind of working up to the point that you can get a vaccine. Or, you know, often these are kids that have other medical problems that need to have labs drawn a lot, or say they have diabetes and they need insulin or something, so that they can do that without, you know, just having a total panic attack and breakdown. So I think, you know, bottom line is, if it's a severe case where you're really worried, you should talk to your doctor and see what kind of advice he or she has. And then, you know, community vaccine availability, of course, like just check with your healthcare provider. local public health offices. Depending on the vaccine, you can get vaccines, of course, like from pharmacies throughout North Dakota. And then there's lots of pop-up clinics, but particularly when you're talking about COVID-19 vaccine. So www.vaccines.gov is a good place to find a vaccine if you're looking. And I think that is about it. So we can open it up for questions. I think I'll hand it over to Molly, and if there's anyone that has questions, we're happy to answer it as best we can.
Thank you, Dr. Newman and Dr. Bakke. That was a really good overview of vaccines for children. So yes, if anyone has questions, please put them in the Q&A and we will try and get to your questions. In the meantime, I do have a question. I was thinking, Dr. Newman, when you were talking, if the R naught for the Delta variant is 6 or 10 and I was just thinking of classrooms or sports teams, it just seems like if we have cases in schools, it's going to spread rather quickly. And I think we're starting to see that in the southern United States. And so I just wanted to get your thoughts on, is that kind of what are your concerns for the upcoming school year for COVID? And then also, last year we didn't have a lot of influenza. I know you guys don't have a crystal ball, but what are you thinking, or what are your concerns around COVID and influenza this fall?
Yeah, thank you, Molly. We can probably both answer this, but very good question, very big questions. I'll try and take the first one. I think that now the CDC, as of last week, and the American Academy of Pediatrics and some other major medical associations have come out with specific guidelines for schools, and it's for K through 12. And within those are, all the kind of things we try. Well, first of all, everyone is pushing for children to return to in-person instruction, and there's no question that should be our #1 goal. And so then the thinking is whatever we need to do to make that happen and keep that happening safely to avoid having virtual instruction again. And so we talk about the same kind of things, trying to have proper ventilation, social distancing. There's now a lot of talk about 3 feet instead of 6. But even if you can't maintain 3 feet within a classroom, it should not be a reason you don't bring students back. And then they have recommended universal masking as another mitigation strategy for all students, teachers, staff, and visitors to K through 12 buildings. And I think part of that is really just the logistics of if you had optional masking or if you didn't have masking, who would be able to figure out, it would just put a huge onus on the schools, right? So let's say you had an exposure of unmasked people. Well, then you've got to try and delineate, was that person vaccinated? Was that person, were both parties masked? Was it, it would just be, I think, a logistical, really difficult thing to do. Not to mention that the vaccine is not available for children under the age of 12. So you have a huge population within schools that have not yet had that opportunity. So I think those are the recommendations. It will be up to local public health agencies and even local school districts and school boards to decide what each school will implement. But I think if we're following CDC guidance and other medical expert guidance, that is what's recommended, at least until we can have more children vaccinated. Your second question is a really important one, and I think it's a big one. One of the things we've seen, from this current, I guess I like to call it, we almost pushed back some diseases. So you're right, our rates of things like croup and RSV and strep throat, and flu, we just didn't see them last year. It turns out that masking and hand washing and distancing works for all viruses, not just coronavirus, thankfully. But what we've now seen as we've opened things up across the country and kind of loosened on some of that is an unusual surge in RSV in its seasonality. So we're seeing it here locally. Like, it'd be very unusual, I think Dr. Bakke would agree, to see RSV in July or August. It's just almost unheard of. But we're seeing lots of it, and some hospitals in southern states are full of kids with RSV. And so one of the big questions is, we don't know as pediatricians, what is it going to look like for your child to have COVID and RSV? I can't tell you that we don't have, or this new Delta variant, right? And I think that's really scary. What is it going to look like if you have influenza and Delta variant, at the same time? And these are just big unknowns that we don't have data for yet in pediatrics. So another bonus of potentially universally masking or following some of these is you would see much higher transmission rates of other pediatric illnesses.
And Dr. Bakke, we received a question about VAERS, the Vaccine Adverse Events Reporting System. I think there's a lot of misinformation out there that says thousands of people have died because of the COVID vaccine. And so can you kind of talk about what VAERS is and isn't, maybe, so people can understand how to put those reports in context?
Yeah, 100%. That's a really good question, I think. So VAERS is the Vaccine Adverse Event Reporting System. And that's just one way that we monitor how people do post-vaccine. So anyone can report to VAERS. Physicians and nurses can and should. I mean, if you have a patient who has an unusual, reaction or response that might be from a vaccine, parents, patients, lawyers, literally anybody can report. So that's just kind of like an information gathering system that you can use that can kind of set off some alarms, like, oh, we're seeing a lot of reports about thrombocytopenia after MMR vaccine, and then they look and they search it further. So just because something happens after you were vaccinated doesn't mean that the vaccine caused it. Just a report doesn't mean that it was from the vaccine. And so there's just like more research that's necessary. So looking at a VAERS report, just because somebody said something happened after a vaccine, and it probably did. I mean, I'm not denying that what people put in VAERS is often or probably usually like a true, but we have to remember that like bad things happen every day. COVID-19 vaccine, for example, is only meant to prevent COVID-19. I mean, it's not meant to prevent strokes or heart attacks or car accidents or all of the other things that can happen after you have a vaccine, all of the other things that happen every day. I have a physician friend who was talking about several months ago getting her father set up for a COVID-19 vaccine, when it was available. And like the night before he was to get the vaccine, he had a massive stroke. And she knew, and she's a doctor, and she knew that if that had happened 12 hours after the vaccine, there was literally nothing that could have convinced her that it wasn't related to the vaccine. But it wasn't. I mean, it didn't happen before. So sometimes, I mean, the timing of things can be unfortunate, and that's why we have to, consider numbers, and we have to look at a lot more than just like those individual reports, which again, like those individual VAERS reports are really important. And, these are the things that kind of helped us define some of the side effects that we know exist from vaccines, like myocarditis, for example, that wasn't really seen in the studies, previously, but once that was released out into the public, it was a rare enough side effect that we were able to pick it up, even at only 1 in 20,000. So it's not that like we're not trying to find these things. We are trying. We found a fairly rare side effect that happens only in 1 in 20,000 people. But again, VAERS is just like one tool. It's not the only tool.
So, and Dr. Newman, this might be a good question for you. We had a mom ask a question, she's kind of concerned about sending her teenager to school this fall. What is your message to parents that are concerned about COVID and sending their children to school? And do you have any guidance for them on, is there anyone they can talk to about that or express their concerns to?
Yeah, thank you for the question. I think first, as Dr. Bakke stated multiple times, we recommend talking to your healthcare provider or your pediatrician. They're probably the best poised to know what's individually right for you and your child. I would also encourage you to follow local public health guidance because they're looking at your county numbers specifically. They're looking at your rate of risk within your community. So there may be different guidelines in different parts of our state or, of course, different parts of our country. But I think just some generalities, right? Vaccination is our #1 recommended tool. That is the best thing to keep your child safe during this pandemic. I do think the benefits outweigh the risks of returning to school, so I encourage kids to return to school. I think it was a stark reminder this past year, all of the things that schools provide for our youth, right? Not just education, but nutrition, physical activity, services to internet, and services to adults for other needs, mental health and the like. So I think all those things are very important. Vaccination is the #1 tool, because regardless of your school's policies about masks or quarantining, etc., if you are a vaccinated adolescent, your odds of being severely sick or hospitalized or death is very, very low. I mean, almost nothing, right? So that should give you solace. But also logistically, if you're exposed to COVID and you're vaccinated, there's different guidelines about what would happen after that. You essentially don't have to fully quarantine. You're encouraged to test after a certain day, but you don't have to. So I just think it would make your life a little easier. But we do encourage following all the new guidance from, released from the Centers for Disease Control as well.
All right, and I think we have time for one last question. Dr. Bakke, do you feel that COVID vaccine is an authorized vaccine, it's authorized by the FDA. Do you feel once the FDA fully approves COVID vaccine that it's going to impact what you're seeing for parental acceptance of the vaccine?
That's a really good question that I've thought of myself. I hope so. I mean, I do have a lot of people that say that, they're not FDA approved. I think that, I think a lot of parents were hesitant right away. And with time they see, okay, my friends, my family, other people's kids have been vaccinated. And so I do think there'll be increased acceptance with time. Are we going to have like a huge influx after, I personally, I think feel like FDA approval is inevitable right now. I can't think of, what would slow that down. Do I think we're going to have like a huge onslaught after that happens? Probably not. But I do think that it will push, some people to feel more comfortable at that point. So we'll see.
All right. Well, I just want to thank Dr. Newman and Dr. Bakke for being with us today. And again, August is National Immunization Awareness Month, so you should get your vaccines every month when you're due, but it's especially important this month when we're heading back to school to make sure kids are protected against vaccine-preventable diseases in the school setting. So please make an appointment at your pediatrician or other healthcare provider's office. I do want to mention that this webinar will be archived and available on the North Dakota Department of Health YouTube channel, Facebook, and Instagram, so please be on the lookout for that. And thank you to everyone who attended today. And again, I just can't thank you enough. Thank you, Dr. Newman and Dr. Bakke, for being with us today.
Yeah, thanks for having us.
It was a lot of fun. Thank you.